Hi, John Crowley here again with McLean County Orthopedics Physical Therapy, and today we're going to talk about acute neck pain. So please note this video is not intended to diagnose, nor should it take the place of any regularly scheduled physician or therapy visits. So the presentation we're looking at with neck pain today is maybe you just woke up with some one-sided, right side or left side neck pain, and it's acute in nature, meaning it's very recent onset. Another presentation is if you just quickly turn your head to one direction or the other, and the direction you turn to you feel a sharp pain or maybe a burning sensation, or what some people would call a crick in the neck. That's what this technique is going to be used for. So what's actually going on is you've pinched a little bit of the joint in there, and we call that a facet capsular entrapment. So I'm going to show you a little self-assessment to determine if that's what you have, and we're going to show you a little treatment for that as well. So our self-assessment, we're going to deal with my colleague Tessa here today. We're going to say that she has this sudden onset of this right side neck pain. Typically, this does not present with any radiating pain into the arm or down the back, okay? But it could if it's gone on for more than 24 hours. So the technique is safe in any instance. It's just going to be more effective if it's done very early on. So Tessa's presentation, we're going to say that she has some right-sided neck pain, and that's actually going to increase symptoms a little bit when she bends to the right, when she turns to the right, or if she tries to look up. Now the reason that's increasing pain is it's compressive to that joint, and just like if we jammed a finger and we pushed more on that joint, it would be painful. The same thing's happening in the neck. Those compressive forces are actually causing increased discomfort there. So your self-assessment is if it's painful going that way and it's not painful going opposite ways or ways that are decompressive to the neck, like looking down, shouldn't be too painful, tilting away, good, and then rotating away, those should not be painful. There is going to be a little swelling in the joint, so it's going to feel stiff, but you shouldn't get that sharp focal pain. Okay, so if you do that self-assessment and you pretty much fit the bill with that, then we're going to take you through a little bit of treatment. So we're going to have Tessa take 2 to 3 fingers and place them on her temple, and then she's actually going to rotate just to the point where things start getting uncomfortable. And she's going to hold her head there while her fingers give just a couple pounds of pressure, trying to push her out of that. Okay, we don't want to push too hard. We don't want to induce any strain in the neck, just enough to create some muscle activation. I'm going to have her go through 4 sets of these, holding each press for about 4 seconds. Okay? What we're doing with this is we're actually using the muscle to pull on the joint the same way with a jammed finger. We would kind of pull on it a little bit to decompress the structure. This is going to be effective in actually starting to improve a little bit of motion and allowing us to turn into what was that block or that painful range. So she's done her 4, she's come back to center, and now we're going to turn as far as she can to that new range to where things start to get uncomfortable again, and we're going to repeat this process. Typically, if I give someone this to do at home or if we do it in the clinic, we're going to run through this 4 sets for 4 seconds, 3 to 4 times, and we're going to see what kind of motion they tend to get out of that, and then we'll keep an eye on that. Now, it is acute in nature, so there's going to be some swelling in the joint, so you're going to want to follow this technique up with some ice, and you're going to want to avoid any compressive forces to the neck in that direction or any rapid movements, because this can kind of happen again if you go through those things again. So treat it gingerly, ice it, do this technique as much as you need to keep your motion, and things should resolve in a day or so. If not, give us a call at McLean County Orthopedics, contact one of our physicians or our therapy department.